Hi, everyone. This is E. David Crawford, Editor-in-Chief of Grand Rounds in Urology. The management of patients who have biochemical failure after radical prostatectomy has remained challenging, primarily because conventional imaging, CT scans, bone scans don't provide a lot of information. Most recently, more sensitive and specific scans have emerged. PET-CT scans, one is fluciclovine, others are PSMA gallium. Joining me to discuss an exciting new manuscript that was just published is Dr. Peter Rossi, who is a radiation oncologist at Valley View Hospital. And he is going to talk to us about the results of this study employing fluciclovine and directing radiation and showing improved outcome. Peter, thanks for sharing this with our audience.
Good day. My name is Peter Rossi. I've been asked by Dr. Crawford to review this topic, the role of molecular imaging to improve cancer control for patients post-prostatectomy. Thank you for your attention. And really, more specifically, I'm going to discuss this publication this week in Lancet on fluciclovine PET, or what we call the X-Men scan. And this study, published by a group of researchers out of Emory University in Atlanta, Georgia, led by Dr. Ashish Jani and David Schuster, is a study looking at fluciclovine PET imaging versus conventional imaging in the clinical scenario of a PSA rise post-prostatectomy. And this is the result of their randomized control study. So after radical prostatectomy, a PSA rise may happen, and we know that it is associated with metastases and prostate cancer-related death. Now, postoperative radiotherapy may be offered. It could be offered adjuvantly or salvagely. The decision to offer postoperative radiotherapy is complex, and failure rates still remain high. So there is risk of prostate cancer death following prostatectomy. This is Friedman and Parton's publication in JAMA 2005, retrospective database review of nearly 400 patients who underwent radical prostatectomy without adjuvant or salvage radiotherapy. And prostate cancer death is predicted most significantly by more advanced Gleason score, but going out 7 to 10 years, nearly 50% of men may succumb to prostate cancer death without appropriate adjuvant therapy. And we know through multiple randomized controlled trials that radiotherapy works. This is a recent publication from Radicals RT from Parker, published in Lancet in 2020, showing however it works, failures are still common regardless of the approach. So how can we improve? And what is the value of molecular imaging? Over my career, the idea is to add it because molecular imaging, like X-Men scan, may yield higher diagnostic yield than conventional imaging. I'm fairly certain of that. It may change postoperative management amongst many disease sites. It may make therapy more individualized and personal to the patient, because we're commonly asked the question, what are you treating? Urologists, patients, it's commonly what they ask us, because in this postoperative setting, the PSA has risen, but conventional imaging like a CT of the chest and abdomen, an MRI of the pelvis, a bone scan are negative. So they're wondering what we're doing. And so these investigators asked, can we be more effective with outcome, cancer outcome specifically, with molecular imaging? So molecular imaging, where does it come from? Where is it going? First, we had the Prostate scan, FDA approved in 1999. In 2012, C11 choline approved, commonly performed at Mayo for this clinical scenario. Dr. Mark Goodman's lab at Emory University invented fluciclovine, which we know to be X-Men, which is an amino acid analog that picks up prostate cancer, ultimately becoming approved in 2016 and fairly readily available in the United States and elsewhere. And finally, there is more PSMA scans, and which was just recently approved in early December of 2020. So back to the investigation that led to this publication in Lancet this week. This was initially funded by an R01 grant dating back to 2012. This study went on for 5 years. The principal investigators were Ashish Jani and David Schuster. Their primary aim was to improve cancer control in this clinical scenario, the post-prostatectomy setting with a PSA rise using fluciclovine PET. The secondary aims were to evaluate the role of molecular imaging in radiotherapy decision-making and targeting. And this is very innovative and bold in prostate cancer to suggest imaging could possibly improve cancer control. We know imaging for accuracy and diagnostics, common publications and studies, possibly decision-making, but actually improve cancer control. Really applaud them for the innovativeness in which they went about this. This is the schema on the left. Patients with the PSA rise post-prostatectomy with negative imaging, conventional imaging of the time, bone scan, CT, MRI, were then enrolled and randomized to either having traditional radiotherapy based on standard imaging, arm A, or with the addition of a fluciclovine or Axmin PET, which was arm B. And then it was a rigid decision on how that information on the experimental arm, the arm with the PET, was to be managed. For instance, if there was extra pelvic disease, number one here, we would abort radiotherapy. So in the publication, this is the table 1, well balanced. They enrolled 165 men between September of 2012 and March of 2019. And the primary endpoint was cancer control, such as PSA failure, initiation of ADT, or clinical or radiographic progression. And this is what they found. This is the first of the results showing that what they found by PET uptake on the experimental arm and what led to decision changes. So in these men that had negative CT, MRI, and bone scan, they actually found a lot of findings. In 4 patients of the 79, they found extrapelvic disease. In 27, they found disease in the pelvis or the prostate fossa and the pelvis. In 32 patients, despite negative MRI, bone scan, CT scan, they found it in the prostate bed. And a minority of patients, they found no uptake. And this led to changes in decision-making for radiotherapy. So for instance, in patients that were planned for prostate bed only, based on the conventional imaging beforehand, significant amount of men had treatment of the pelvis. Likewise, when the doctor ahead of time said, hey, I'm going to treat the prostate bed and pelvis, a significant amount of patients, because of uptake that was not in the pelvis, went back to prostate bed only. And again, for patients, no radiotherapy was offered because of findings of extrapelvic disease. So overall, 1 in 3 patients had a significant change to their radiotherapy plan, or no radiotherapy was planned based on the PET scan, the fluciclovine Axmin PET scan. This is one example that they published, an example of the decision change. You can see conventional imaging here, really nothing to see. However, when you add the PET scan, we see multiple periordic lymph nodes, extrapelvic disease, and radiotherapy. And this patient in particular was canceled. They were found to have M1 disease and went on to systemic therapy. So this is the key slide here. This is the failure analysis comparing arm 1, which was conventional imaging, guiding post-operative radiotherapy, versus arm 2, which involved the PET scan, the Axmin PET scan. And what we found is the 3-year failure-free survival was 63% with conventional imaging, but improved to 76% when the PET was utilized. And then a multivariate analysis using conventional imaging was associated with worse outcome versus the PET, hazard ratio of 2. Also, such things as extracapsular disease, Gleason score of 8, 9, or 10 was significant for worse outcome as well. So what I learned from this Lancet publication from the investigators of Dr. Jani and Dr. Schuster is it's meaningful to complete a novel randomized controlled trial of molecular imaging to seek to improve cancer control endpoints. Very important. This is very novel. And that fluciclovine X-Men PET significantly improves failure rate post-prostatectomy, gives us better selection of patients, better targeting of disease, and ultimately led to less failures. An imaging study alone led to less cancer failures. An integration of PET changed postoperative radiotherapy intent, target delineation, and improved cancer outcomes. And just to go back to this, they showed 3-year and 4-year results. And if you look at the 4-year results, you have this durable 75% control post-prostatectomy of the PSA rise. That's 3 out of 4 men get benefit of postoperative radiotherapy, whereas you continue to have failure in the conventional arm. So at 4 years, 50% of guys failed with just conventional imaging when given radiotherapy post-prostatectomy after a PSA rise, versus only 1 in 4 when we utilize PET. So future directions, where does this stand today? Fluciclovine is available in my practice, has been for years. I use it always in this clinical scenario. I have a lot of enthusiasm about PSMA, but it has yet to be studied in the same manner. There are intrapatient comparisons, multiple publications suggesting that it may be a little bit better at detecting extraprostatic disease than FA-CBC or fluciclovine PET, may be better at lower PSAs. However, fluciclovine may be better in detection of disease in the prostatic fossa, which is really what we're looking for. And it's an unknown impact on cancer outcome. So actually, these investigators were awarded the next R01 and have been enrolling men on a study comparing PSMA scan versus the fluciclovine X-Men PET scan. And so we'll await results of this study to know more. So I would like to acknowledge Dr. Shishjani. He's a close colleague and friend. He shared with me his slides from his astroplenary presentation on this matter that led to the Lancet publication this week. Dr. Schuster and the entire Emory team, the GRU team, and Dr. Crawford. Thank you very much.